Nephrotic syndrome is a condition that is associated with proteinuria in excess of 3 to 3.5 grams per 1.73 meters squared daily, accompanied by hypoalbuminemia, edema, hyperlipidemia, and hypercoagulable states. Diuretics should be used with caution and not given as a routine in children with nephrotic syndrome. So the causes for primary glomerular disease, the main causes are minimal chain disease, which is common in children, and also focal and segmental glomerulosclerosis, and membranous nephropathy, and membranous proliferative glomerulonephritis. Could be from infections, could be bacterial, post-streptococcal infection, also viral hepatitis B and C, HIV, and could be parasitic like Plasmodium malariae, Schistosoma mansoni, and filariasis. Also systemic diseases like diabetes mellitus, systemic lupus erythematosus, and amyloidosis. And so it could be from drug-related causes like non-steroidal anti-inflammatory drugs, as NSAIDs. So the symptoms are early morning facial puffiness, generalized body swelling, foamy appearance of urine, weight gain as unintentional, and poor appetite. The signs that are usually elicited are periorbital, peripheral, genital edema, and also ascites, pleural effusion, protein malnutrition, particularly in children with long-standing disease. Investigations: urinalysis, BUE creatinine, serum albumin, serum lipids, fasting blood glucose, serology, hepatitis B, C, HIV, HB electrophoresis, antinuclear antibody, that's ANA, and ultrasound of kidneys. The main treatment objectives are to relieve symptoms, to treat underlying conditions, to prevent and manage complications, to delay progressive kidney damage. Non-pharmacological treatment: restrict salt intake, adequate protein diet, 0.6 to 0.8 grams per kilogram body weight of first class protein like eggs, meat, fish, dairy products per day for adults, and 2 to 4 grams per kilogram per day for children. Of pharmacological treatment, for the control of edema, first line treatment, we give furosemide IV, adults 40 to 80 milligrams, 8 to 12 hourly, the maximum of 160 milligrams daily. In children, you refer to specialists. In children, furosemide is used in conjunction with albumin infusion only in severe edema. Or you can also give furosemide oral in adults 40 milligrams daily, increasing to 80 milligrams daily with a maximum of 240 milligrams daily. Children, refer to specialists. For the control of resistant edema, if furosemide IV or oral, is the same for adults and children. And then you give metolazone oral in adults 2.5 to 10 milligrams once daily. Children, you refer to a specialist. So diuretics should be used with caution and not given as a routine in nephrotic syndrome in children. And for the control of proteinuria, give lisinopril oral in adults 5 to 20 milligrams daily. And then give prednisolone oral in adults 1 milligram per kilogram daily. In children, 60 milligrams per meter square, or 2 milligrams per kilogram daily with a maximum of 80 milligrams. And for long-term management, you refer to a pediatrician. So corticosteroids should be given to children and selected adults with minimal change in nephrotic syndrome by specialists only. Referral criteria: you refer all patients to a physician specialist, pediatrician, nephrologist immediately after diagnosis and stabilization.